All right. Welcome, everyone. Thank you guys for joining us for the first of hopefully many Supreme Nutrition Products webinars. We have an exciting doctor to speak to you guys today, but we just want to get a little bit of an intro. Hopefully we won't have any technical difficulties. We've been using Zoom a lot lately for other things, but when you're hosting and recording and things like that, hopefully we won't have any issues. But we will be recording this, putting it on YouTube. If for those of you who haven't used Zoom a whole lot, at the bottom there's a chat window, and if you have any questions at all as we go for Dr. McAllister about anything that he says, please type it in the chat window, and then we'll, as soon as we can, we'll interrupt Dr. McAllister and then have him ask him the question for you, just kind of the easiest way for continuity. If you guys have any questions at all, please feel free to put it here, and like we said, we'll try to get it online if people have any questions, but otherwise, I'm going to give it over to, and for those of you who don't know me, I recognize most of the names on here, some of the faces. My name's Dr. Noah Leibowitz, and here's my dad, Dr. Michael Leibowitz. So he's just going to give an intro for Dr. McAllister, how he knows him, a little bit of his background, and then we're excited, and thank you all for joining us.
Hi there. So I met Heath, how many years ago do you think it was?
It was probably like 2008, maybe 2008, 2010.
I was living in Arizona. I had a good friend, Dr. Don Baker, and Heath and Dr. Baker were really good friends. And Heath and I got together, I think I was living in Tempe, and I was so impressed with his knowledge of herbs, not only from a traditional standpoint, but also from a biochemical standpoint. And I could just throw out names of all these different herbs that I was foraging and all these different herbs that I knew from the tropics. And he just knew them all and could share all kinds of clinical tidbits and also different published research on them. And so he's one of a couple of master herbalists that we have with us for Supreme. A lot of times they will come up with different ideas for different products that they think will help all you guys. And it's our job to find sources and test the sources and see if we can find a source that we're happy with the quality and they're happy with the quality, and it kind of goes from there. Dr. McAllister has taught at the naturopathic school in Arizona, and also the one in San Diego, I believe. And he has had a successful practice in California, and also online, and a little bit in Oregon. I hope you guys are going to learn a ton.
And he does a really great job too of blending, for those of you guys that do muscle testing, applied kinesiology, but also functional medicine, lab results, and everything like that. And he really blends them all into one, which is another unique but great aspect about him. So like I said, we're going to give it over to Dr. McAllister now. If you guys have any questions, please feel free, type them in down here, and we'll get to them as soon as we can. We're going to be talking about 6 really great and amazing products. And yeah, we hope you guys enjoy.
All right, super. Well, welcome everybody. I'm super excited to talk about these herbs. When I first met Michael and we just discussed herbs, it wasn't necessarily even make products. It was just things that I thought were really useful and exciting. And luckily, Michael had this feed into this company that he could actually make things happen. So I'm really happy to have made that connection, and I really, really appreciate all the work that Michael's done and all that I've learned from him. A little bit about, my approach to patient care is I do muscle testing in my practice, but I also do a lot of lab testing. Usually the way I like to work it is that when I meet a patient, I first do an intake, and then I try and get some labs on them. So I have some kind of concrete data to jump off of. So I might get some, food panel, might check cholesterol, might check microbiome, nutrient levels. There's lots of things that I might check. And then in between the time that I recheck them, I usually use muscle testing as a way to guide my treatment, to figure out, okay, you can't just treat and test and treat and test and treat and test. There has to be some period in between there where you're trying to figure things out and you're feeling things through. Muscle testing is really valuable for me. In fact, I think if I had one modality that I do, and I do a lot of modalities, muscle testing is the #1 thing that the most valuable tool that I've got at the top of the list. But I do love lab testing, and I do think that everyone needs to kind of make sense of how they proceed through patient care. So the first herb that I want to highlight today is an herb that we more recently came out with, or Michael and Noah did. It's called Albizia Supreme. So Albizia is Albizia julibrizin. And in Chinese medicine, this is an herb that was thought to bring joy to the heart. So this is, you know, in Chinese medicine, they talk about the Shen. The Shen is kind of your mentality, but it's also your spirit. In Chinese medicine, they talk about all sorts of different analogies to nature and so forth. And something that brings joy to the heart, it seems really good. Herbs that typically treat Shen disturbances or spirit problems or heart problems, or what we would call depression or mood disorders, would be things like that might help with insomnia or elevate mood. And so with something like Albizia, it's been historically used for just basically mood disorders. If you dig into the research a little bit, you see that Albizia is used for, or how it might actually function. It does interface with serotonin receptors and it interfaces with GABA receptors. So serotonin is a major neurotransmitter that's usually highlighted when we talk about anxiety or depression. It's one of those things that gives you kind of a buffer in life and helps you feel more stable and kind of more blissful, more happy. And so Albizia does activate those receptors. It also activates GABA receptors, which GABA is the main inhibitory neurotransmitter in the body. So you have excitatory neurotransmitters like glutamate, and then you have inhibitory neurotransmitters like GABA. Well, this activates GABA as well. So not only helping calm anxiety and making you feel connected and more buffered in life, it also helps with anxiousness. So typically when I would think about a patient that comes in that might need Albizia, obviously I like muscle testing, but my clinical mind always goes to, okay, what herb might help this person? What nutrient might help this person? Albizia is one that I think about for a broad spectrum of mood disorders, anxiousness or insomnia even, irritability, any kind of mood issue. I would also say that in a general term, I would term it as what's called a tropho-restorative. So tropho means like a level of the body. So a tropho-restorative for the lungs would be something that heals the lungs and, you know, helps with lung function. I consider this herb a tropho-restorative for the brain and nervous system. And beyond its ability to actually activate serotonin and GABA receptors, it also does have a general anabolic or tissue growing effect. So it's been used for wounds like bone problems and sinew problems and skin problems. So it does have a regenerative quality, which makes it very special. I mean, there's not a lot of things that have kind of regenerative quality like that. Other things that tend to, I would think of for this herb is it is loaded with saponins. So saponins are these molecules that have both a water element and a lipid element. So essentially saponins are things that have a detergent-like effect. So that can be really helpful when you're trying to, say, dissolve a biofilm in the body. Biofilms are ways that critters, bacteria and parasites and yeasts can kind of clump together and evade your immune system, create a protective coating over themselves. So dissolving biofilms is something that's really paramount if you really want to treat those infections. So Supreme has like the HemoGuard product, which is an awesome product. And there's other products that have saponins in them, like the Danshan and the Smilax. This is also one of those saponin-containing herbs. So not to pigeonhole it, that it's just a neuroprotective or, you know, mood-stabilizing herbs. It does have these secondary benefits. So in the course of your muscle testing, if for some reason this comes up when they have an infection, it makes sense to me why it would come up. Some other things that I would like to mention is that it does have significant anti-inflammatory effects. In fact, 6 times the level of vitamin C antioxidant effect. So it's not an insignificant antioxidant, anti-inflammatory. And it also does have some pain relieving effects. So let's say someone does have a wound like an ankle sprain or a fracture. You could consider this herb on many levels. It's anabolic. It's been historically used for wound healing. It's antioxidant. So on all these levels, I could see this herb having a much broader application than just neuroprotective, mood stabilizing, and so forth. But that would be my first thought, is that if someone has any kind of mood issue, you could consider using Albizia. So a little bit about dosing for Albizia. I generally do twice daily dosing because I feel like it's easier for most people. So even though I might want to get 3 times a day dosing into people, I generally do twice a day because I'm pretty sure they can do something right when they wake up and right before they go to bed. So with Albizia, it's anywhere from 2 to 3 capsules twice a day. And I really do see that mood stabilizing effect and helps with insomnia, people getting better sleep, just gives them better buffering for their life. So that's most of it. The triterpenoid saponins, I mentioned that. It does have quercetin in it. So again, that anti-inflammatory aspect to it. So any questions about the Albizia? I know it's a newer one and that people may not be as used to using it, but any questions that have come up for you in terms of the Albizia?
Like I mentioned, if anyone has any questions, please type them in the chat box, but I have a couple for you. Do you give different dosage or recommended times of day if people are more taking it for anxiety or for sleep issues?
Yeah, sure. I mean, obviously, if you're taking it for sleep issues, you might want to dose heavier in the evening. So that's where you might do 4 capsules at night before bed. If it's for anxiety, if you can do the daily dosing in the middle of the day as well, 2 capsules, 2 capsules, 2 capsules. So 2 capsules TID 3 times a day. That's not a bad dosing schedule. And the great thing about this herb is it's very safe, so that if you feel a positive benefit from it, you can dose up. You could do 4 capsules. It's fine. Some people complain about, I'm just eating capsules all day. So, but if you're not one of those people and you can handle it, you can do more capsules. The only mild precaution I would say is if someone is taking a standard antidepressant drug. So most standard antidepressants, we have newer ones that are coming out now, but most of them are still falling into the category of selective serotonin reuptake inhibitors, which means you're inhibiting the breakdown of serotonin. So you're keeping serotonin longer in the synapse between the 2 neurons. So this does have an effect activating those serotonin receptors. I think the risk would be very mild of having anything what's called serotonin syndrome if you were to take this on top of doing a traditional antidepressant. But I just wanted to mention that each person's a case-by-case basis. If someone's really on a high dose of Lexapro or Prozac or something, you might just take it slow on this one.
Someone just asked if you recommend taking it with food or before food.
You know, it's interesting. I consider most herbs like a concentrated form of food. You know, that's how we would traditionally have gotten them in, is that in Chinese medicine, they decocted them, they boiled them up and they drank them. I don't know that food affects the absorption of this at all. So I think that if you're trying to maybe do it strictly for the biofilm dissolving aspect, maybe on an empty stomach makes sense. But there's no stomach irritation that you'd get with this one. It's not like taking a bunch of zinc on an empty stomach. So I think as long as you're getting it in, it's just fine.
And one other question, so you mentioned taking it with SSRIs. What about taking it with benzodiazepines? Do people have to worry about that?
Yeah, I mean, I guess it's a similar kind of relative contraindication because benzos work on the GABA receptor system. But the difference between taking, Valium versus Albizia is it's like a drop of water versus a flood. Yeah, they're both liquid, but one is like hit you over the head and knock you out, drug-like effect. Whereas the Albizia, the whole herb, and it's one of the reasons I like whole herbs, there's often a lot of synergistic molecules that are working in concert with one another. If you extracted just one of these saponins or one quote unquote active constituent, you might have more of a drug-like effect and you might get into more of a problem. But I haven't seen any problem, and people take benzos and SSRIs all the time. I have never seen anyone have any kind of conflict taking them.
Awesome. We have 2 other questions real quick. I just see from Dr. Weisfield, we saw he raised a hand versus Zoom. I'm actually not quite sure what that means. So if you have any question, you could try to unmute yourself or type. Sorry, technical difficulties. We had a question from Scott Forsgren about if you found it helpful in those dealing with MCAS.
In which, what's the acronym?
MCAS.
Multiple chemical sensitivity?
Mast cell activation.
I think mast cell activation syndrome.
Oh, sorry. Specifically mast cell activation, I wouldn't rule it out. I'm going to say there's a lot of other herbs that I would probably put ahead of Albizia in terms of their anti-inflammatory effects. One of the other ones we're going to be talking about today, Manjistha, I think is much more in line with that. But I would say as part of an overall treatment protocol, if they also tend to have anxiety or some depressive aspect and they have mast cell activation, yeah, would this specifically stabilize mast cells? I believe that would be true, but I don't know that there are things like, it does have quercetin. So yes, should have some stabilizing effect. Is it going to be on the order of magnitude of some of our other herbs? Not sure. I think it's worth a shot. Absolutely.
We had one other question about if Albizia would interact with people with ASD, so autism spectrum disorder, or psychosis symptoms.
You know, I don't have a reason to believe that it would aggravate autism at all. In fact, I mean, autism is a difficult multimodal issue. I mean, essentially, I consider it a neuroinflammatory condition. So I think it can only be helpful in the sense this is neuroprotective and mood stabilizing. I don't see an issue with it at all. Usually herbs that have saponins are anti-inflammatory. This has the quercetin. I think it could only be beneficial. I haven't ever seen it aggravate. I don't know that I've specifically dosed it high in an autism spectrum child or adult. So I can't speak to it personally, but in theory, there should be no issue with it at all. In fact, it should help.
Dr. Weisfeld, did you have a question?
Yeah, I do have a question. I was using Albizia, and for some reason, I don't usually test the herbs that I find separately, but I tested it against the liver of a patient that I had already found would benefit from it from testing. And it tested weak against the liver, and I tested against a few patients and found that it stressed the liver. And it's not something I usually do. I don't know if you have a comment on that.
I haven't seen it specifically weaken the liver myself. I'm not sure exactly why that is, other than it's possible the saponin effect could lead to a little bit more of a detox. If that person is toxic, could it detox them too quickly? Could it strain the liver? I suppose in theory it could. I haven't seen that. I sometimes find this herb will go hypertonic on people, and that's something you should definitely all be checking for, is hypertonicity. It's usually when I do a muscle test and it's deceptively strong, then I do a sedation point and I try and see if is it truly strong. This one sometimes does cause hypertonicity. I'm not sure. I haven't tracked it to the liver, but that's a good suggestion that may be what's happening.
Yeah, so maybe in those cases, see if some kind of liver detoxifier might take that weakness away.
Yeah, it could negate it. Maybe something like a glutathione or an NAC or something could maybe negate that and still allow that herb to be taken in conjunction.
Okay, thank you.
I wanted to add one thing for people who like to prescribe based on symptom pictures, since Dr. McAllister is also going to be talking about Mucuna, which affects epinephrine, another mood elevator. I tend to look at things that affect serotonin, being for people who, when they're depressed, they always want to be around people and they want to be able to talk their issues out with people. And the people who are needing more GABA stimulation are the people who drive themselves crazy, while the people who need more epinephrine activity are the ones that want to curl up in a ball and be left alone. So that as a very generalization type guideline for which of the things that affect neurotransmitters.
Yeah, I think that's a good suggestion. Okay, super. Any other questions on Albizia? Again, I think it's got a really unique place in our pharmacopoeia in terms of its neuroprotective, mood stabilizing effect, and also that anabolic and trophorestorative effect on the brain.
Okay. Well, let's move on to Mucuna.
Okay, super. So Mucuna pruriens, velvet bean. This is an herb from India that is, it's been historically used as a forage food. So plants, or the leaves were eaten by animals, and people have eaten the pods and the cooked beans for thousands of years. This one's claim to fame is that it actually contains material amounts of L-dopa. So dopamine is the other main neurotransmitter we think about when we talk about mood stabilization. Dopamine is different. There's some crossover with serotonin in the sense of how it kind of creates a buffer in the system. To me, dopamine creates a sense of connectedness and belonging and satiety. So a lot of things that might make you feel satiated, like eating a really good meal or eating dark chocolate or having sex, or for people that are drug users, it's one of the things they're after when they're doing cocaine and heroin. You're getting a huge burst of dopamine. And that's why those drugs are so powerfully addictive, and chocolate is very addictive, and cigarettes and so forth. So dopamine is one of these things that we seek as human beings. It's that feeling of connectedness and safety and satiety. And increasing dopamine levels in the brain can be very, very useful for helping curb addiction. So first thing I think about with Mucuna is addiction and mood disorders. So there's about 4 to 7% L-DOPA found in Mucuna. So the way dopamine is synthesized in the body is you have an amino acid, tyrosine, then it's hit by an enzyme. It's like, tyrosine hydroxylase, let's say, and then it becomes L-DOPA, and then DOPA decarboxylase turns it into dopamine. And then from dopamine, it can go on and become norepinephrine and epinephrine and so forth. So, but increasing the dopamine levels, you can feed someone tyrosine, and that does help some people, but you can also give Mucuna because it kind of circumvents, it's further on down the list. Tyrosine can become a lot of other things in the body. It can become thyroid hormone. To make sure that your L-DOPA is actually getting created and used for mood issues and addiction issues, giving Mucuna seems to be a little bit more straightforward. The other thing I would say is that it's also been used for certain movement disorders like Parkinson's disease. So Parkinson's disease is a destruction of an area of the brain called the substantia nigra. Substantia nigra is our richest collection of dopaminergic neurons in the entire brain. And what dopamine does there is it actually inhibits movement. So in order for my arm to flex and extend, I have to inhibit one compartment in order to allow the other compartment to contract. If I don't inhibit, if I'm activating both compartments, then I have what we call cogwheel rigidity, where your muscles are fighting against each other. And cogwheel rigidity is the hallmark, one of the hallmark symptoms of Parkinson's, because those people are having destruction of that area of the brain. They're not having enough dopamine produced. So a lot of Parkinson's patients have benefited from taking Mucuna because it's supplying more dopamine to that area of the brain. And they have documented that it does cross and it does help Parkinson's patients. And the drugs that do that, like levodopa and carbidopa, which are kind of the mainstay drugs for Parkinson's disease, they have a lot of nasty side effects, what are called extrapyramidal effects. Whereas Mucuna doesn't seem to have these negative side effects, and you don't seem to acclimate to taking Mucuna, which is great. Some other things that I would highlight about Mucuna is that it has historically been used for low libido. So dopamine is involved in having proper libido. It's also been used for other movement disorders like epilepsy. So again, spastic problems. Some other things that Mucuna is great for is it's also loaded with saponins. So could you use this for biofilms? Yes. Can you use it in SIBO? Yes. It's antioxidant, it's neuroprotective, and it also has some antineoplastic effect. So there are some what are called cyanogenic glycosides in Mucuna. So that means basically if you liberate it, if you break the molecule apart, you now have basically free-form cyanide or hydrogen cyanide. And that is very toxic to your normal healthy tissues, but a thing like cancer cells, which are very hungry cells, they gobble up that cyanide preferentially and they can be poisoned by them. It's also anti-diabetic effects. I mean, this one's a pretty big and complete herb. I would say it's really the other half of brain nourishment from the Albizia. If I had two herbs to completely nourish the brain, it would be Albizia and Mucuna. You're getting your dopamine, your serotonin, your GABA, your neuroprotection, you're getting your saponins from multiple angles, your multiple ways that you're having antioxidants. So it's a great herb. Definitely, I would say the first thing you think about are mood disorders with an emphasis more on addiction and anxiety, or even panic disorders, and then substance use and Parkinson's, movement disorders. So in terms of dosing, what I usually do with Mucuna is I usually do 2 capsules twice a day, and that's like a middle of the road dosing. And I may increase that. I may say, if someone's acutely trying to say quit smoking, or they're trying to quit heroin or something, I might start them higher. I might do 5 capsules twice a day, just to really increase that dopamine, then taper them back off once they've broken that vicious cycle. So, but generally a good middle of the road dosing is 2 capsules twice a day. And one thing I did want to mention, and this is really like an interesting anecdote, is that in India, this herb was prescribed for snake bites. And that's generally not a big problem for us in US northern climates, but in the tropics, it's a big problem. and they actually found that it does actually have legitimate effects against snake bites. If you do an intramuscular injection of Mucuna pruriens, that person is protected from snake venom for like a month, which is kind of interesting. So what questions does anyone have about Mucuna? It's a great herb. Okay, so how long is it good for a person to, I can't see the entire answer from Carrie H. You can see that, Noah?
Yes. How long is it good for a person to take Mucuna?
Yeah, so I don't see it as a problem to take it for longer term. I don't see people acclimate to it. For me personally, the way I approach it is the way I approach most of my patients, is that I'm not going to usually prescribe something to someone for, say, 6 months. I might give it to them for a month and then recheck, and either by what I can tell how they're responding, or from a muscle test, I'll be checking in with them. But I've had people stay on Mucuna 4 months. I just don't routinely do that. But if I don't think there's any harm in prescribing this for months. If they're benefiting from it, I would say that most things, even with the Albizia, most adrenal herbs, most stuff that I prescribe, unless it's an antimicrobial, I usually do some amount of break. So I might put someone on something for 2 weeks, then have them take, maybe a 4 or 5 day break. And that's so that their body is still impressed by this herb and this substance. I think it probably still works, but I feel like it works just a little bit better, especially with adrenal things, if you give little breaks, and then you might revisit that herb.
So if you use L-tyrosine as amino acid, with some people, if you give it to them later in the day, it'll keep them up at night. It seems to due to, eventually turning into the norepinephrine pathway. Right. You see that with Mucuna also, it could keep people up.
I haven't, in theory, it might do that too, but I haven't seen it cause insomnia like that. So, and I don't know how many hundreds of people I've given this to, but it hasn't seemed to be a major problem.
And we just had a question from Donna about any problems putting a person on Mucuna who's currently taking antipsychotic medication and or antidepressants.
Again, antipsychotics, those are hard-hitting drugs like olanzapine. Those are tough ones. A lot of complicated neurochemistry going on. I would say go low and go slow. They don't necessarily conflict. I would definitely say you want to be cautious if someone's taking Parkinson's meds, because those are doing a concerted effort to try and elevate dopamine. But for antipsychotics, depends on the antipsychotic. Antidepressants, no, there are very few antidepressants that target dopamine. There are the SNRIs, so the serotonin norepinephrine reuptake inhibitors. So those do have some degree of dopamine conservation, as well as the catecholamines or epinephrine, norepinephrine. I would be more cautious with those. And again, if you're not sure, go low and go slow. Do 1 capsule at night before bed. If it works out, 1 capsule twice a day. You just ramp up slowly if someone's on some hard-hitting meds. Was there another part of that question that I didn't answer?
I think that was...
Okay, we got it.
No, that was good.
Okay, super. Well, if there's no other questions on that one, we can move on to the Manjistha. So Manjistha is one of my favorite herbs. It's an anti-inflammatory, but it's also a lymphatic herb. So it's going to help with lymphatic drainage. I think of it as a lymphatic astringent, that it will actually maybe astringe the lacteals and cause a little more pumping to happen at the lymph nodes. So, and editorially, I find that a lot of people with any kind of active infection, especially fungal infections, they tend to have gunked up lymphatics. And if you don't muscle test for it, it's pretty easy. You basically rub against the flow of lymphatics and check for a weak muscle. And it's not the only herb that does this. There's a lot of other ones like cleavers and phytolacca and red roots, but this one's a very gentle lymphatic stimulator and a powerful anti-inflammatory. I consider this one to be the water-soluble curcuma being turmeric. We all know the benefits of turmeric. It's amazing. It's anti-neoplastic. It supports the liver, does this and that. Manjistha is like the water-soluble turmeric. Does almost all the same stuff that curcuma does, but there's no problems with absorption, which is great. And you can prove that to yourself. If you take 4 or 5 capsules of Manjistha, it will turn your urine darker. It'll be either reddish or brown. And anything that got into your urine got into your bloodstream, because your urine is an ultrafiltrate of your blood. So Manjistha is absolutely getting absorbed and having an anti-inflammatory effect. So I would say the conditions that I recommend that for most, or if I think kind of shooting from the hip, any kind of autoimmune condition, which has an overwhelming kind of overshadowing inflammation as the immune system is attacking your own tissues, but any kind of gut inflammation as well. So Crohn's, ulcerative colitis, skin inflammation. Historically, this is an Indian herb, an herb from India that was used for helping with boils and rashes and all sorts of skin inflammation that more than likely was the manifestation of an inside-out inflammation, that there was either some infection or some inflammation from the inside out presenting on the skin. So it's a great one for skin inflammation. You potentially could put it on topically. I haven't really done that, but you could make a paste with it as well. So it's a wonderful herb. I use this one a lot. Whenever someone has overt inflammation, the two things I think about are curcuma and Manjistha, and you can combine them with no issues. Like I said before, the issue with curcuma is that it's not well absorbed. It's fat soluble. And so that's why they make all these phosphatidylcholine linked versions of things, or they tell you to take it with, you know, yogis would boil it in warm milk or this and that to make it more absorbable. But Manjistha, you don't have to worry about that at all.
Just to throw in one unique thing I like about Manjistha is, I mean, studies have shown it can increase white blood cells by over 150%. I know I had a client and her white blood cells via lab work have been chronically low for over 20 years. And I had been working with some other stuff and she was feeling great. So she asked me that. And so basically I said, hey, let's try Manjistha. And she was on it for a month and we rechecked her labs and it was the first time her white blood cell count was actually within normal limits.
That's fantastic. Yeah, and is it that it just had that lymphatic stimulation effect? So more white blood cells were liberated from lymphatics? We won't ever know, but I think that's a great anecdotal story. You know, I would definitely say astragalus would be something I would think about for that patient as well.
On patients that are going through some type of detox program, be it sauna therapy or some type of, you know, very simple diet or, you know, something to help detoxification, would you think that Manjistha would complement that then because of all its properties?
Absolutely. I think it absolutely would. I mean, it supports the liver, supports lymphatic drainage. I think it absolutely would. I think for someone trying to detox also, we're not talking about it today really, but Takasumi, obviously, you know, to create almost like that sink for toxins to be pulled out irreversibly. And they could be used in conjunction as well, just at different times of the day. So in terms of dosing, I didn't mention that, but with Manjistha, I mean, honestly, this one I find effects with even as little as 1 cap twice a day. But there's no harm, and it has what's called an LD50, or you know, a toxic dose of Manjistha was determined to be, you know, they fed rats like grams and grams of this stuff. So body weight dosing, it would be the equivalent of like me eating a pound of it, and there was no toxic effect. So in terms of safety, it's super safe. In terms of you know, diminishing gains after you're taking, you know, 5 to 10 capsules, you may not be getting that much more anti-inflammatory effect. So I think a ballpark would be, you know, middle of the road dosing would be 2 to 3 capsules twice a day. I think you're going to see a significant benefit from that.
Carrie had asked if you could repeat the overshadow comment that you said regarding Manjistha.
Yeah. Well, in terms of conditions that have autoimmunity, autoimmunity has an overshadowing inflammation. When you activate and irritate the immune system to attack your own tissues, there's tremendous collateral damage that happens. So in any autoimmune patient, I think about curcuma, Manjistha. I might think about something like DHEA, which is an androgenic hormone that's low in autoimmune patients. You're thinking about things that generally quench that fire that's being produced by your own immune system. And there's tremendous amounts of it. So that's why RA patients or we talked about mast cell activation, which this herb would absolutely be in line with mast cell activation.
Awesome. And remember, if people have any questions, please chime in. Just before we keep going, I just wanted to mention, for the products that Dr. McAllister is talking about today, Albizia, Mucuna, Manjistha, he's going to get into Illicium, Uva Ursi, or Vital Guard. If any of you haven't used them before, wanted to order them, trying your practice, if you place an order on Supreme Nutrition's website and type in Mucuna as a coupon code with a capital N, MUCUNA, If you order before Thursday, you'll get 10% off any of the products that he mentioned. So if you wanted to try them on yourself for patients, please feel free. And then just, Carrie just asked real quick if you can take Manjistha longer term also.
Yeah, absolutely. This one's super safe. I mean, like I said, the LD50 is huge. So yeah, you can take it safely for long term. And I have had this, patients on this one for months at a time. I always like to recheck, but in the absence of it, this one's such a safe herb. I do a lot of phone calls with patients, especially now with COVID happening. And I prescribe this one from, based off of phone conversations and knowing that the over inflammation. One thing I also forgot to mention about Manjistha is that it's also been historically used for any kind of musculoskeletal inflammation. So if you have, wounds or a fracture or bruising or anything like that, this would be a powerful anti-inflammatory to have on board.
Great, thank you.
Absolutely. Super. Well, if there's no other questions for that one, we can move on to Illicium. So Illicium Supreme, this herb is, I love this herb. It's one that people will be familiar with in the terms of its star anise. So like anise seed, it has similar essential oil fraction, but it has a completely different shape and it's from a tree, whereas anise is from a shrub. So star anise, Illicium verum, it's very rich in essential oils. The aromatics of this herb are powerful, and those aromatics like fennel, it does smell beautiful. The aromatics like fennel, whenever you smell that intense essential oil aromaticity, it's going to have what's called a carminative effect. A carminative effect is essentially relaxing the gastrointestinal tract. So classically, this one was used for colic. So gas, bloating, colic, indigestion, any kind of GI upset, Illicium is indicated for, as would regular anise would be indicated for. The difference is that Illicium has some really other potent effects. So it is one of the richest natural sources of a thing called shikimic acid. Shikimic acid became really a famous molecule when they were looking at antiviral compounds. And in the production and manufacture of the drug Tamiflu, they start with the parent molecule is shikimic acid. And then they end up with this thing Tamiflu. Now Tamiflu doesn't work that well. It will reduce incidence of your flu-like symptoms by like about a day. So it's not really super effective, but I found that the whole herb, using the whole ground up herb, can be a powerful antiviral for a wide variety of viral infections, not just the flu virus, but anytime someone is presenting with any viral issues, so it could be sore throats, it could be fever, and you're thinking it's more virus than bacteria, Illicium is one of the top herbs. There are top things that I think about. We'll mention one of the other herbs later on today that I also think about, but it's a wonderful antiviral. Also used historically in Chinese medicine, which it comes from the Chinese pharmacopoeia as an antiparasitic. So if someone has parasites, worms, roundworms, Blastocystis hominis, anything like that, you can consider using Illicium. And I have used it effectively to expel those parasites from the gut and verified that on retesting. So the other thing I would mention about Illicium is that it has a neuroprotective quality, and that's been documented with research, that it has, it's maybe useful for preserving cholinergic receptors in the brain, which is the target or the susceptible target in Alzheimer's disease. You're losing a lot of acetylcholine receptors. So this is a neuropreservative effect. It also, interestingly enough, is used like fennel in the sense that it has been historically used to increase milk production in lactating women. So obviously it's going to be safe in breastfeeding. Now I think the flavor may come through a little bit in breast milk. You always have to be worried about strongly flavored herbs when you're breastfeeding. Most of them are not going to have a toxic effect, but they may change the breast milk flavor, like garlic. You eat a lot of raw garlic, it's coming through in the breast milk, and your baby might be like, what the heck did you just give me? So know that about Illicium, as it may come through, even though it does have that, what we call galactagogue or milk-producing effect.
I know, just to chime in there, I mean, definitely Illicium is one of my absolute favorite antimicrobial herbs for pregnancy or breastfeeding. It works awesome, also along with VitalGuard, which you'll be talking about, one of my two go-tos. And I know, like you mentioned with the shikimic acid and the flu, it's definitely become, I mean, I always like to get hands-on with patients, but it's been my go-to always for influenza. I mean, I've had so many patients, I'll triple their dose, do 3 pills 3 times a day, and patients that either swear they've gotten the flu every year and they're coming down with it, it's gone in a day, or people that have been sick for a week or two, and you give it to them, and that's the first thing that broke their symptoms. It's absolutely amazing for that. It blows my mind every year.
Yeah, and I would like to jump on that like the 3 caps 3 times a day, that's usually the acute dosing that I use as well. So if you're going to do some kind of flu prevention, you can do, 1 capsule twice a day. But if you feel like you're coming down with something, hit it hard, hit it often. 3 caps 3 times a day, no problem. Again, this is a very safe herb. You can read about some toxicological reports in the research. A different herb was used, a different type of Illicium, not Illicium verum, was used. So if you find that, if you look out there and you're like, oh my God, Illicium can be poisonous, yeah, the wrong kind of Illicium can be poisonous. So any questions about Illicium? And we had some people chime in that they love this herb because it smells amazing, and it does. It smells great. If you don't like licorice, though, which it has kind of a licoricey effect, or a smell, you're not going to like the flavor of this one. Is it safe for babies? It really, I don't give a lot of stuff to babies. The way I usually would give anything to an actual infant would be have the mother consume it and have it come through the breast milk. So could you tap a little bit of Illicium on a child's tongue? Totally. It's not toxic in any way. I mean, it's a food additive. It falls under the category of generally recognized as safe, GRAS. So just keep in mind that infants are very sensitive little creatures, and a little goes a long way. It would be the kind of thing like historically people used a thing called gripe water, where gripe water is a bunch of essential oil rich herbs that were steeped in water, and you just use a few drops of it. You could use the Illicium, like I would probably say an Illicium tea, with just a few drops of that would have the same effect as a gripe water or a Florida water.
That's great.
Yep, super. All right, well, if no more questions on that, we will move to Uva Ursi. So Uva Ursi is a favorite herb of mine. I've been muscle testing this one for a long time, and I'm glad the Supreme came out with a version of it. It's called bearberry or Arctostaphylos Uva Ursi. It's a beautiful shrub that grows in usually subalpine areas. Historically used as a kidney tonic. And so you think about what conditions might someone need kidney herb for. A lot of times it would be something like a urinary tract infection. Also, you could say maybe something like kidney stones, which historically this was used for as well. So it was identified as a strong kidney herb. So that historically is how it was used, UTIs, kidney stones. The thing about it is that modern research has found that it's actually a powerful antibacterial and antifungal. So this is one of my favorite hard-hitting herbs for clearing out nasty infections from the gut. I love Malia, as Noah and Michael do too, and I revere Morinda. They're these herbs that we love. I think about Uva Ursi along lines with golden thread and Malia, Uva Ursi. I would kind of lump them. Maybe you guys would now include Vedanga in that as well. But like these kind of sacred, hard-hitting, powerful antimicrobials, I put Uva Ursi there. There used to be some concerns that it might be not safe for long-term use. Those got debunked. You can use it longer term. I usually don't put someone on a really hard-hitting antimicrobial for more than a month. I would just say editorially. Something that's gentler like Morinda, I think you can safely take that for months on a time. But something like Uva Ursi, golden thread, Malia, I question the utility of putting someone on that for more than a month. I think after 2 or 3 weeks, you've done most of the good those herbs can do, and you might need to rotate onto something else or take a break and then come back. So Uva Ursi's a great herb. It's, like I said, I've done tons of cultures and sensitivities on patients, which basically means I look at their stool and what kind of critters are in their stool. And a lot of times those lab tests will give me what natural agents will kill the bacteria or yeast or parasites that are found there. And Uva Ursi is like almost across the board always shows really high inhibition. So yes, it has a UTI effect, antimicrobial UTI effect, which means you're going to get some absorption into the urine. And we know that the pharmacology of it is that it's rich in this source called arbutin. And arbutin will break apart into 2 molecules of hydroquinone. And hydroquinone is a powerful antibiotic. So it does have a very kind of drug-like antibiotic effect. kills all kinds of organisms, everything from Shigella to Mycobacterium, H. pylori, E. coli, Pseudomonas, Salmonella, most of the nasty ones that you would think about, as well as Candida albicans, which is so common. So clears tons of stuff out. I would also say that it's got a nice antiviral effect too. So it's been used primarily against herpes family viruses, but also influenza. So it's not the primary thing I think about, but as a secondary benefit, it's a great antiviral. And then it was also shown to reduce calcium oxalate kidney stones by like 95%. So it does have a diuretic effect. And if you're flushing fluids through the urinary tract consistently, you are going to prevent stone buildup. You're going to flush little stones and prevent bigger stones from building up. I don't know if that's exactly why that's happening, but I bet that plays a role in it. So it's a great herb. I would also say that you will come across it that it's been used to lighten the skin topically. Hydroquinone has been used to lighten the skin. So some Asian cultures, you know, people that have darker pigments want to be lighter. People that are lighter like myself want to be darker. It's just, that's how the world works. And it's used in skin lightening creams. We had a question, does it work on all types of stones? I only know about the calcium oxalate stones. I don't know about magnesium oxalate stones or struvite stones or other stones. The only reference I saw that was calcium oxalate. I would imagine it helps prevent all stones, but in terms of treating stones, you got to be really careful about any herb that has a reputation for actually breaking up stones. I don't know many herbs that actually might break up stones. There are a few that were kind of, that it was mentioned, the pharmacopoeia, but this one, it was really about prevention.
If someone had an active UTI, would you dose it? How high would you go? And would you have them take it between meals or make it as a tea or anything like that? Or,
you know, ideally you would make it as a tea. Now, it's not a tasty herb. It's pretty astringent and bitter, which could be, you know, could prevent someone from actually getting it down. So if you can open up 2 capsules into a cup of water, let that steep and drink it, amazing, because that water is going to be a vehicle that then brings it into the urinary tract. If you can't handle it, then taking the capsules, it's fine. I would probably dose it, probably the highest I would dose would be 6 capsules daily. So 2 capsules 3 times daily in an acute dosing, kind of like I would Malia. I don't really go higher than that in Malia as well, or Golden Thread. I pretty much stay in that realm. That 6 is my limit. Usually 4 is my usual. But you can do 6 capsules a day. I think you're just fine with that, tea or capsules.
and did you see the question from Scott Fortgren? Might Uva Ursi help to minimize the effects of oxalate dumping when one reduces dietary oxalates too quickly?
I mean, like I would expect almost all diuretics to flush most kind of noxious minerals. So I would expect that to be helpful.
And then we also had a question, since kidneys related to hypertension, any relationship?
In terms of helping hypertension, I mean, it depends if your hypertension is related to chronic kidney failure or true kidney problems. I mean, your kidneys are the master of the water balance in your body, right? They determine how much fluid to flush and how much fluid to keep. And they do that by flushing electrolytes or keeping electrolytes and proteins and so forth. So if you're having hypertension because of some kind of glomerular breakdown, Uva Ursi isn't really like a restorative for the kidney. It's not nutritive for the kidney. It does diurese you. So for that alone, there should be some kind of effect. But I would actually probably refer someone to more like a dandelion leaf, which is diuretic, but also replenishes potassium. So if you truly wanted to diurese someone, I would say maybe nettles herb or dandelion leaf, not products we make, but you know, could you use, you know, would it be kind of a bonus in someone that has hypertension? Sure, totally. Okay,
Great.
any other questions about Uva Ursi? Again, I think this is one of our heavy hitting antimicrobial herbs, and I would, if you have someone with a significant infection, I would definitely keep this on your list. All right, super. Well, our last herb is called Vital Guard. So it's not the name of the herb, it's the name of the product. The product is Chrysanthemum morifolium, which is a lovely flower, and it's been used in Chinese medicine for thousands of years. They still use it as a tea, and it's delicious. It's a delicious tea. It's uplifting, it's joyful. I love Vital Guard. It's one, I think it's the first herb that we collaborated with, Michael. I think this was the first one. There's lots of research on chrysanthemum. So it is hepatoprotective, it's neuroprotective, it's antioxidant, it's anti-inflammatory. It's also very gentle. So Noah, you mentioned this is one of your favorites for pregnancy and breastfeeding. It's one of the few antimicrobial herbs that I feel safe giving during pregnancy. During pregnancy is mainly kind of a hands-off in terms of getting major work done. Usually when a woman gets pregnant, what she's got is what she's got. You can't really shift it that much because most of our herbs that are toxic to bacteria or fungus can also be maybe toxic or it might promote uterine contractions, things you don't want. So, but Vital Guard or chrysanthemum is entirely safe in pregnancy. It's anti-inflammatory, it's wonderful, safe in breastfeeding. It's gentle, but it's very effective. It's a nice antifungal as well. The thing that I really love about Vital Guard is that I have treated many Lyme patients. And for Lyme sufferers, I find this really helps almost sweep Lyme from the nervous system. So if someone's really having a lot of like stiff necks and headaches and mood problems secondary to Lyme, of course, Lyme's one of the great imitators, so you might not have tracked that down. But even people that have, Lyme has gotten so deep into their system that they're having heart palpitations, I found this herb to be invaluable. So most of my Lyme sufferers, I have them on this herb, sometimes long term, and it's wonderfully protective for the brain and a lot of other organ systems. So Vital Guard, think about it as kind of an all-purpose, gentle antimicrobial, but also hepatoprotective, neuroprotective, anti-inflammatory. You could never go wrong with giving this herb. And I find that me taking it, if I drink the tea or I take the capsules, it makes me feel happy. Like I feel good taking this herb. It brings joy to the heart, kind of like, it has some Albizia effect. I'm sure it is elevating serotonin or dopamine. It's something like that. I didn't find research on that per se, but I believe that it's having some kind of neurotransmitter effect.
I know one interesting thing that I read about was how it's immune modulating and it has a lot of similar properties to echinacea. I mean, I've never personally seen this to be true, but have you ever seen it to be an issue with autoimmune conditions because it ramp up the nervous system too much? Like I said, I've used on a lot of autoimmune people. I've never seen that, but since I know echinacea is known to do that in some people.
Yeah, I think about echinacea as a little bit more immune stimulating in terms of we know that echinacea will improve your natural killer counts, natural killer cell counts. I don't know if Vital Guard is actively stimulating the immune system or has more of just an active antiviral and antimicrobial effect. I think it's more the latter, that it's not necessarily stimulating your immune system. I think it's actually directly going after the microbes and has an anti-inflammatory effect.
So, Heath, the natural pest guys that come around and they use, I'll pronounce it wrong, but the pyrethrin type chemicals that come from chrysanthemum, is it the same variety of chrysanthemum?
I believe it all is, yeah. You mean you're talking about the, if you're making an insecticide, right?
Yes. Mm-hmm.
Yeah, I know that. I believe it is the same one. And also I would mention that chrysanthemum is also the source of chrysin, which chrysin is a flavonoid that inhibits aromatase. So aromatase, and I don't really use Vital Guard for this way, but I could see it as a secondary use. Aromatase is an enzyme that interconverts estrogen and testosterone. So I've treated dozens of guys, younger guys too, that have very high estrogen. And usually the thinking is either they're exposed to some kind of foreign estrogen or they're having that enzyme rob them of their testosterone. It's being shunted over into estrogen. So aromatase inhibitors are one of the big ways that we can pharmacologically kind of stop that process from happening. And chrysanthemum is a rich source of chrysin. Chrysin is not super well absorbed. So I would just make that comment that it could have some peripheral effect, but if someone truly has high estrogen, I don't just put them on Vital Guard. I'm gonna probably do other things with them as well.
I know it has, do you ever think of it as good, have some of the properties basically to help protect against mental damage and cardiac damage due to
Absolutely. Absolutely. So any kind of neurodegenerative problem, so like Alzheimer's, dementia, if someone's having, say has had toxicity, like heavy metal toxicity, which can really affect the brain, especially mercury. If someone has Parkinson's or MS, absolutely, it's neuroprotective. And I would also think about Albizia and Mucuna in there too. I think you could kind of combine all three of those into a really powerful antioxidant neuroprotective complex. Even if you don't do muscle testing, you can't go wrong using those herbs. You're not going to hurt someone, and you may really help delay their or stop their disease process.
People have any questions about VitalGuard, please feel free to ask. I have one question just kind of going back. In the research that I've done, I mean, for Albizia, you know, I definitely, the main things I think about it are sleep, anxiety, you know, the serotonin GABA pathways. But in Chinese medicine, it's known as a very good lung herb. So have you seen it with people with respiratory disorders, especially some of the stuff going on heat now, it could help with that? Or is it?
Yeah, I actually do think, I would say this in terms of any of your saponin containing herbs have a lung effect, because you have a substance in your lungs called surfactant. And surfactant allows oxygen that you breathe in to diffuse through 7 tissue layers into the bloodstream. So to facilitate that process, there's a thing called surfactant, which basically helps the oxygen get pulled into the alveoli and it's whisked away. So anything that has a kind of detergent-like, saponin-like effect potentially really facilitates that process. So there's a lot of other, like the ginseng family of herbs, like Aurelia or actually Panax. A lot of our adaptogenic herbs have that saponin-like effect and that lung kind of supportive effect. I also think that Albizia has kind of an astringency to it, and I think that it probably is useful for asthma because of that. Asthma or COPD, it's going to astringe the lungs and kind of make them more resilient.
That's great, thank you.
You want to just open up for any
Does anyone have any questions about any of the herbs that Dr. McAllister has talked about, or just we have a couple more minutes, any questions at all regarding herbs between the three of us? Hopefully we could give you a good answer.
or Supreme?
Or Supreme questions, patient questions. Do we have anything that people are interested in? So we have like an extra couple minutes. Yes. Is there anything else you'd like to add in, Dr. McAllister?
I think Carrie's writing a message right now. I would say that one herb we didn't mention, which actually Noah, you and I collaborated on, which was Scutellaria.
Mm-hmm.
I would like to bring up Scutellaria because that's one of the ones that I looked at. Scutellaria is one of my absolute favorite herbs. It's great for inflammation. It's a potent anti-inflammatory. It's also a great carminative. Scutellaria has the quality of both being bitter and sweet in Chinese medicine. And so it's great for digestive conditions, also great for allergy symptoms, also a nice antimicrobial, antifungal. I love Scutellaria. I use it for a lot of applications. I consider it very, very safe. Just wanted to bring that up, that's kind of in the whole realm of other kind of utility herbs that people may not be using on a regular term. Can you use Scutellaria long term? Yes, you can. Yes, you can. You can use it.
Right before the
antimicrobial effect probably to be somewhere around the line of Morinda.
Dr. George asked if any of the herbs that you've talked about are blood thinners.
You know, none of the ones that we've talked about today are overtly inhibitory of platelets. There's no appreciable amount of blood thinning effect. Definitely nothing like a HemoGuard or any of these other herbs. So no, and nothing like a ginkgo or a garlic, which are arguable in the degree of anticoagulation anyway. So no, there shouldn't be a problem.
Carrie asked if anything to support someone that's going on Abilify.
I mean, I would say that any of your neuroprotective herbs, your Albizia, your Mucuna, those kind of herbs would probably be very helpful for creating greater stability.
Well, like I said, thank you guys, everyone, for joining us today. I learned a lot. I took notes from Dr. McAllister, definitely a wealth of knowledge. I'll be posting this on YouTube, technology supporting, if I can figure this out later today. But also, like I said, if you want to try any products, you can order them by Thursday, coupon Mucuna. Otherwise, if you have any questions, feel free to email us and we can pass them on to Dr. McAllister. And we hope to do some more of these and look forward to talking with you all in the future. Thank you very much.
Thank you so much.
Thanks, everybody. Have a great night.